New videos every day.
Greetings again. This is Athena Jezik. We're going to work on some more videos and explain some things out. And sciatica seems to be a problem that many people suffer from. So I thought I would go through a little bit more sciatica work and explanation on how I deal with sciatica. There's many different techniques that people have, but for me this has been the most effective. And I'm also learning that there's different types of things that come from that area. Sciatica usually is pain coming from about here. When it's real bad, it'll run down the leg. It's a nerve pain, so it runs as though it's like a hot iron or a hot rod going down the leg. Very uncomfortable. Sometimes there's pain though in other parts of the hip, which isn't really the classic sciatica, but it does still involve things similar because there's so many nerves that come out of this sacral area. So that's another thing that I've been discovering. So not everything that happens with the pain in the hip and going down the leg is maybe the classic sciatica, but it doesn't matter because, in my opinion, naming a lot of things doesn't really do anything except for make it a disease, and then a disease is only by law treatable by the Western medical people. So that's just names and labels. The thing is we want to get people out of pain. We want to move them into a space of being able to function well. So in the pain area of the hip, impinging nerves and creating bad sensation or pain down the leg, we'll call that the sciatica pain. And of course, it comes from here, and I find that it is always got a direct connection to the positioning of the sacrum. That also has a direct connection to the position of the sphenoid bone at the occipital base. And I'm going to show you a little bit of this I'll just show it to you now. Excuse me, it's early in the morning and I'm kind of foggy today. So the sacrum is sitting here, and that sacral bone, there's a lot of nerves that come out from here, okay? These little holes are where they come out of. So if that is positioned a little bit crooked on there, which happens quite a bit, then we're going to have this pressure. The nerves are not going to be coming out with the proper alignment, and the nerves are going to have pressure on them when they're twisted a little bit. Sometimes this bone can be in a position that's a little more like this, or it can also be in a combination of that particular pattern. So it's important to be able to allow this bone to be able to lengthen down. This is something that is better done if the body can do it itself. If it's forced into it, it doesn't always mean that it's going to hold, because there's a bunch of stuff underneath there, all that the network of the fascial structure, the membranes under that will twist like a nylon stocking. And so if it's forced back, it'll go back, but then because of the underlying structures there, it will pull it back into that odd position. This is translating up into the head, and because I'm a cranial sacral therapist and have been doing it for so many years, I have a lot of understanding how these connections are made. So right in there, where the purple and the yellow come together, is the sphenobasilar junction. The sphenoid bone is this yellow bone right here. And so that bone touches all the other bones, and it does relate directly to the sacrum at this joint. So if this sacral structure is sideways, it's crooked on there, if that's going to be placed and it's going to be like so, then the same thing is going to happen up at the head. This sphenoid bone is going to be out in a similar manner, because it's a counterbalance for what's going on with the body. So it keeps things balanced so that we feel somewhat straight. So that's the areas that I look for in work around low back pain, particularly down in the sacral area. I do not like to do the hard pushing with the elbow. For one thing is you can get through muscles that way, but your elbows are not very sensitive as to what you're really doing and what structures you're on. And I have found that when I've tried to work elbows, even forearms, the bones and the bony surfaces, it's just too rough. I don't feel good about it. It doesn't feel productive, and so I don't use that method. Also, sometimes when the nerve is affected, there's inflammation. So in my opinion, the way that I see things is by driving yourself into that nerve through those muscles with a bunch of inflammation going on is not really going to help the problem. So there's little things like that that I usually pay attention to, that I don't know if many other people take a lot of that into account, because we do get sort of a technique to loosen things up, and it doesn't always provide for us the thoughts of what's happening at the subtle anatomy level. So I test this by just checking at the occipital base and at the sacrum to see the position of everything. And once the position is established, then I can go in and work with the sacrum in order to correct it. Sometimes this will be corrected quickly, and sometimes it's not corrected as quickly. And I believe that a lot of that is because it's maybe not a true, quote, sciatica, but there's other stuff going on, maybe in the hip joint. There might be some kind of misalignment in the pubic arch. There might be some kind of a rotation in the hip as well. So other things have to happen. So here I'm just giving a little drag on the sacrum and letting it loosen up and letting it swim around. And my other hand is at the occipital base, just steadying the dural tube. And so from there, I just wait a little while, and then I will soften the muscle area around there. Sometimes I work really different. It just kind of depends. So much of my work is intuitive. There's somewhat of a protocol that I follow, but each person presents things differently. No two bodies are ever the same. No injury patterns are ever the same. So flexibility is important to be able to move from various techniques and not follow things too rigidly, particularly in pain problems and issues. And then the other thing that I will do is to get my finger at the base of the sacrum, or excuse me, at L5S1, which is right in this area here. L5S1. So try to put some distance between there, because that's where the jamming will probably tend to be, is right there. Sometimes it's at the coccyx, and I'll show you that technique as well. So with that, you just do a little stretching, integrating in with the muscles, integrating in with the tissues, and then just waiting for it to begin to move. This is going face down. There's a better way to do the sacral pull when they're on their back. But this way will also open it up. Either way is fine. And my other hand up here is also feeling some rotation and some movement coming up the spine. So as one area of the spine is off, every little vertebrae is affected to some degree. There's a little bit of adjustment that they have to make in order to keep the misalignment aligned. And the body's just going to do that. It's going to work within the framework that it has, and it's going to normalize to whatever pattern is there. And so there, now we're getting it softened, and now there's a little bit of a stretch happening. I'm stretching downward with the hand that's on the L5S1, and I am taking a little bit of a stretch upward, just a little traction of no deeper than the fascial level. So we have skin, fluid, then fascia. So I'm 3 layers down and giving a little stretch there. And I'm feeling quite a bit of rumbling going on, and there is a separation happening between L5S1. And it just swims around, and the sacrum is trying right now to find its way back to the proper position. It's a good idea to, if you know cranial work, to also balance it at the sphenoid level, because the sphenoid bone, if that's not corrected, can pull this thing out. Sometimes this will correct the sphenoid bone, but it's a good idea to check both. She just had a couple of pulses. There's a lot of activity going on. Even though she's not suffering from sciatica or any kind of hip serious pain problems, there's still a lot of activity going on, which is correcting little misalignments in there, which is a reason that we should be paying attention to maintenance. Even though we're not hurting, we might want to have some kind of session just for tweaking. I see a number of people who come in regularly, every 4 to 6 weeks, just to be tweaked with cranial work. And I myself have an 1.5-hour session with somebody once a month. And I love it when I get it. It took me a while to find somebody that I felt was at my capacity. Okay. And then the other position is just to lay the hand on the sacrum here and curl the fingers at L5S1 and give a little bit of traction this way. This is a little tricky because you have to keep the palm of the hand pretty secure and the fingers have to bend. So there's quite a lot of technique in the hands in order to get the right feeling. And then the hands have to work independently because I'm right at the sacral coccyx junction and I'm stretching downward on that while I'm allowing the movement, which is a little bit of a swaying motion at L5S1. So there's a downward traction as well as this is being loose to be able to align. At the same time it's being tractioned downward. Okay, and there's some movement happening. These techniques will usually give quite a bit of change to the pain. It doesn't mean that one time is going to give total remedy to the problem, but it does begin to correct that space. Once that's corrected, then we can go in and also work into the muscles, much deeper into the musculature. And the only reason I work into the musculature is to loosen the muscles so that they're not cinching down around those nerves. Because if they're cinching around those nerves, then they're not going to let go real easy, even though the alignment happens. So I just work really deep into these gluteal muscles for the purpose of the muscle. Again, not the purpose of the nerve. And I'm careful if I go into the area where the sciatic is the main place where you can feel it. I do not go into that with a lot of deep pressure because, again, I don't like going into the inflamed areas and I don't like going into pain with a lot of pressure. I don't think in my work it doesn't give me the better results. Okay, and then up front, and there's many areas of the hip to take and loosen, and along the ridge of the hip as well, coming from the sacrum. Working all that, and of course both sides are benefited. I won't do too much on this side, but both sides are benefited by that. And you can even go into the attachments of the hamstrings. In fact, it's a good idea to make sure that the quadriceps and hamstrings are well stretched. So with this, there's also some stretches that can be done with the leg, but I'll show that at another time. So basically, what I do is correct the position of the sacrum to alleviate the pain of sciatic pain or hip pain. Thank you very much. This is Athena Jezik.
Please subscribe to our channel, and you should also visit our new website. Because we have over 1,300 videos on our channel, I know it can be a little difficult to navigate and find the videos that you want to see. But if you visit us at psychetruth.net, you'll be able to find the videos you want to see and watch them there. So we encourage you to go to Psyche Truth next time you want to search for something, and we look forward to seeing you again soon.